As cannabinoids like CBD and CBG gain traction among athletes, their potential role in athletic recovery sits at the volatile intersection of evolving science, athlete experience, and stringent regulations. This analysis delves into the complex interplay of cannabinoids in sports, critically examining both the emerging benefits and unresolved questions, without advocating a definitive stance. Cannabinoids have been proposed as alternatives to traditional anti-inflammatory drugs, like non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, such as ibuprofen or aspirin. While these medications are effective in managing pain and inflammation, they carry significant risks with prolonged use, such as gastrointestinal bleeding and cardiovascular issues. Cannabinoids, on the other hand, interact uniquely with the body's endocannabinoid system to modulate inflammation. Studies suggest cannabinoids may help manage chronic inflammation, a common issue among athletes, without the gastrointestinal and cardiovascular side effects associated with NSAIDs. However, the evidence remains conflicted, particularly concerning acute inflammation, where the role of cannabinoids in the healing process is not fully understood. Research led by institutions such as the University of Colorado is exploring these nuanced biochemical interactions to pinpoint where cannabinoids might offer a true advantage. Athletes' experiences with cannabinoids vary widely, often reflecting the compound's dual potential as both an enhancer and an impairment. While many endurance athletes report benefits in pain management and overall recovery, those in precision sports like archery or gymnastics may face cognitive and coordination challenges, especially when using THC-rich products. The mixed results underscore that cannabinoids are not a one-size-fits-all solution. Their impacts are highly context-dependent and warrant careful consideration of dosage, timing, and individual response. Challenging traditional stereotypes, emerging data suggests that cannabis users, including athletes, may adopt healthier dietary habits than previously assumed. Studies have observed increased consumption of nutrient-dense foods among cannabis users, contrasting with the outdated image of poor diet choices. While causality remains speculative, these findings prompt deeper exploration into how cannabinoids might influence dietary patterns, potentially through effects on metabolism or appetite regulation. Identifying the exact mechanisms and their implications for athletic performance is an important next step in this evolving field. Navigating the regulatory landscape poses significant hurdles for athletes who consider integrating cannabinoids into their recovery routines. Despite growing evidence of therapeutic benefits, cannabinoids remain on WADA's banned substance list, placing athletes at risk of sanctions, including suspensions and loss of sponsorships. High-profile cases, such as that of American sprinter Sha'Carri Richardson, who faced disqualification for cannabis use, highlight the personal and professional stakes involved. Advocacy groups continue to push for policy updates that reflect current scientific understanding, but the path forward is fraught with institutional resistance and a lag in policy adaptation. Looking ahead, personalized cannabinoid protocols represent a frontier, with the potential to revolutionize sports recovery. Early pilot studies are exploring microdosing and tailored regimens, allowing athletes to fine-tune their use to optimize recovery while minimizing side effects. However, the variability in product quality, legal constraints, and the need for precise dosing data present formidable challenges. Real-world applications are still emerging, and comprehensive studies are essential to validate these approaches and refine best practices for athletes. In conclusion, the use of cannabinoids in athletic recovery is a dynamic and contentious field, marked by promising findings and significant uncertainties. Critical questions remain. Can cannabinoids be safely and effectively integrated into recovery protocols? What are the long-term impacts on athletic health and performance? As research continues, the answers to these questions will shape the future of cannabinoids in sports, influencing not just individual athletes but also broader regulatory standards and public perception. Until then, the use of cannabinoids remains a complex and evolving choice, fraught with both potential and caution.